Planning our reopening was sort of an evolution. The Virginia Dental Association issued a recommendation that dental offices close starting on March 17th, as it was a Tuesday, and that came out late Sunday night, so didn't really give us much time to plan immediately. We also had a team to keep in the loop. We had patients, so our first priority was communication, letting our team know that we were there for them. We were going to keep them as up to date as possible. So it was really a good chance for our team to come together. We wanted to let them know we were there for them, that they weren't going to go, without pay. And then, as things dragged on, we kind of guided them through this process together. We wanted to reassure everybody that returning to work was, on their own volition. If anybody had some concerns, some of our team had some family members with some health issues that, they had some anxiety about returning. But just to make sure that we were there for them, that that we were reopened, and wanted to make sure everybody was comfortable too. And we did a live walkthrough of what our new protocols would be.
Protocols are important in all parts of dentistry, all parts of business, to go through the same routine for everybody, so that some people don't feel slighted and others don't feel like they're being prejudiced against. Basically, what we're doing now is all the patients fill, which probably most practices are doing this now, fill out a pre-appointment COVID-19 sheet, testify that they've not been around anybody that's sick, or they haven't been sick, had a sore throat, have a fever. Then when they wait in their car, call us when they get here, and we meet them at the door. We take the temperature with a touchless thermometer, and they're then escorted directly back to the treatment room. There's no reception room seating right now, no magazines or any newspapers, and then they'll have a mask when they come in. They wear a mask except for the time they're having treatment performed. Then they're relieved through a separate door than they came in on. They don't leave on the same door, so there's no crossing of patients in the hallway to maintain social distancing. We have the receptionist bring any kind of forms back to the treatment room, so that most of the times patients don't have to stop at the front desk. We have tremendous response from that. They feel safe, they feel protected, the staff feels protected. We have certain other protocols. We have the patients rinsing with a hydrogen peroxide type mouthwash, 2 30-second rinses, as prescribed by Dr. Rella Christensen. And then we have high volume suction at which she says is 80% effective in getting rid of the aerosols. So we have that at every chair right at the patient's mouth, not just somewhere off in the room. And everybody feels protected. We've not on plastic. We haven't had any problems, and hope to keep it that way. And I think a lot of these protocols we're putting in now are going to be here for a long time, for everybody's safety, and to keep everybody safe and everybody treated well.
One of the big lessons we learned, as we were taking call, is, a lot of these emergency calls we're getting, they're not new problems. They're problems that patients have had, and they've just been unaddressed, and they kind of flared up at an unfortunate time. And as dentists, we need to do a better job of educating our patients on their overall health. So we're really spending time, talking to them and letting them know that, this isn't just something they need to address for a tooth. It's something they need to address for their overall health.
One thing that I think has become evident for us is that our planning will be ongoing, even though we reopened for about 2 months now, that, there's some spikes in different parts of the country, and that we just have to keep our eyes on what's going on. So I think this is going to be something we're dealing with for certainly the near future, if not into next year. So our planning certainly will be an ongoing process for the best of everybody, providing the best care in the safest environment possible.